Hey everybody, Dr. Brooks here. Just wanted to drop you a quick line about a case I just saw. Anyway, when it comes to rashes, one of the things that we want to make sure that we're paying attention to is what might have caused them. And there are a few quick tips that you can use to help your doctor figure out what's going on. First and foremost, you want to look for any new exposures. Okay, so that might be anything from a new cosmetic product to a new medication to new foods, especially important in children. If for some reason you can't identify any new exposures that may have gone on or in your body, think about new places you might have been. Any recent travel to any other parts of the country or state, or even out of the country, those sometimes can be really important. Other things you want to look for are any associated signs and symptoms. Are you having a fever? Are you also having a headache? Is there discomfort when you go to the bathroom? Are you having any chest pain? Are you having any joint pain? Anything like that can be helpful in narrowing down that condition. Also, are there any conditions that you might have that might be important? This is especially important if you have rheumatologic conditions like lupus or rheumatoid arthritis, gout. Even things like cancer can sometimes have skin manifestations. Dietary restrictions also can sometimes manifest themselves. If there's any deficiency, it can manifest as a skin change. So make sure you think about that. And then you also want to make sure if there's anything worrisome that's popping up, I'm having trouble breathing now, and that's new, or chest pain, or anything like that. Think about things that make the symptoms worse or better. When I go out in the sun, it's like way worse. Or when I take an antihistamine or something like, a Benadryl, it gets better. Those are all things that really kind of help us figure out what's going on. So, if you are having any new type of skin lesion, any new type of rash, really, really help out your provider by just thinking about those things even before you come to the visit. Additionally, and I know it happens as it happens to me all the time, you might not be able to think about it before the visit, but if something pops into your brain afterwards, shoot the doctor a little note. A lot of times we can try to figure it out or at least figure out the treatment while we're in person, but it really does help to have some additional information to confirm or maybe even adjust our diagnosis and treatment plan if necessary. All right, well, this is Dr. Brooks just dropping you a quick line. Be well.